Hello friends, we are dealing with retrograde ureterography, pyeloureterography. In this retrograde pyeloureterography, we have learnt about the indications of retrograde pyeloureterography and contraindications. Now let us learn the procedure. In the procedure, we are going to give the contrast medium. And the contrast medium which is used here is ionic contrast medium can be used safely. In these patients, ionic contrast medium can be used safely unless there is any disadvantage like hypersensitivity, or if the patient has any side effects with the contrast media. Unless and until that is the contraindication, rest all conditions you can use ionic contrast media can also be used. Even you can use non-ionic contrast media can also be used. This ionic contrast media is preferred more than non-ionic contrast media because of its low cost. Ionic contrast media has low cost, so as a result, this ionic contrast media is preferred. This ionic contrast media, if you see the strength of ionic contrast media, it should be 150 to 200 milligram liters per ml. Okay, next, the contrast media should not be too dense, because if it is this contrast media should not be too dense, because if it is too dense it will obscure smaller lesions. If it is too dense it will obscure smaller lesions. So as a result, in order to prevent the obscuring of smaller lesions, and also in order to better visualization of ureter and the pelvis, we have to make sure that the contrast media is not too dense. Then what about the procedure of retrograde ureterography? In procedure, first and foremost, you should prepare the patient. In patient preparation, there is no need of bowel preparation. No need of bowel preparation with cathartics. Bowel preparation with cathartics is not recommended in this procedure. Then we will take a preliminary film, or a scout film is taken in this condition also. Okay, and also it can be given anesthesia. Anesthesia is mandatory actually. In anesthesia it is mainly done, it can be done on LA, but general anesthesia is most commonly required in a patient for doing this retrograde ureterography, pyeloureterography. First, in this retrograde pyeloureterography, first half of the procedure is done in operation theater, followed by radiology department. So if you see first in the operation theater what is done. So if you see in the operation theater, first and foremost, the surgeon will catheterize the ureter via cystoscope. So we have to catheterize the ureter by using the cystoscope. The cystoscope is put through the bladder. Through bladder, the cystoscope is introduced, and we will catheterize the ureter. Okay, and then after catheterizing the ureter, we will have to inject the contrast medium is injected. Okay, this is what occurs in operation theater, and then X-rays are taken, obviously. Okay, catheterize the ureter using in a cystoscope, then contrast medium is injected, and then X-rays are taken. Then what about in X-ray department or radiology department? So in X-ray department, first and foremost, previously itself the patient is ureteric catheterized in situ. Ureter catheter is in situ. The patient ureter catheter is in situ. That is, the patient is operated and ureter catheter is introduced in the patient into the patient, and then the patient is uh, transferred from OT to X-ray department. Okay, now in this X-ray department, what happens? In this X-ray department, first and foremost, urine is aspirated, and this aspirated urine is aspirated first, followed by that you will inject the contrast medium slowly. After the contrast medium is injected slowly, almost 3 to 5 ml of contrast medium is injected slowly. Okay, but if at any stage of this procedure, if at any stage of this procedure, if the patient has any pain or fullness in the loin, then you should stop injecting. But generally 3 to 5 ml is injected. After injecting, you will have to take the films. So what types of films are taken in retrograde ureterography? In this, under the coach, using under coach tube, you can do a supine position, that is in PA film. Postero-anteriorly, we can take a PA film of supine position of the kidney. Number one. Second, both you can do 35 degrees anterior oblique positions of the kidney. You can use 35 degrees anterior obliques of kidney can be used in order to for this, and we can, for this retrograde ureterography, in order to visualize the calyces, we should have a low kvp of around 65 to 75 kilovolts peak is necessary for calculi visualization, and for contrast medium visualization we need a kVp or kilovolt peak voltage peak of around 65 to 75 kVp. Next, um, if at any stage if there is pelvic-ureteric junction obstruction is present, in such cases, first and foremost, you will have to aspirate the contrast medium in pelvis. You will aspirate the contrast medium in pelvis. Okay. Now, after doing the films are examined. If it is good, then you will withdraw the catheter. If good films and good everything is good, then you can withdraw the catheter. Obviously, because the procedure is over, so you can withdraw the catheter. Number one. This catheter is withdrawn. First, it is withdrawn to 10 centimeters below renal pelvis. Number one. Okay. You will withdraw the catheter first to 10 centimeters below the renal pelvis, and then inject. And then in this position, when the catheter is 10 centimeters below the renal pelvis, inject the contrast, and then take an X-ray. Number one, this is also an X-ray. Okay, then second, this is the first. Second, then again withdraw the catheter to lie above ureteric orifice, just above the ureteric orifice. Also, ureteric orifice also, you will have to inject the contrast and again take another X-ray. So now this is also gives one more X-ray. So actually you are taking a supine PA X-ray, then 35 degrees anterior oblique you are taking, and followed by that, if these two films are good, then first you will have to withdraw the catheter up to 10 centimeters below the renal pelvis, and then inject the contrast. Similarly, you can also withdraw to lie above the ureteric orifice, and then again withdraw the catheter. Sorry, then again inject the contrast and take an X-ray. Now, so this is about the procedure and taking the films. Followed by that, you will have to see the complications of this retrograde ureterography. So in retrograde ureterography, we are giving anesthetic to the patient in order to introduce the catheter into the ureters through the cystoscope. So obviously there will be complications of general anesthesia which are common. Second, this complications can also be due to contrast media. The contrast media, if it is absorbed from the renal pelvis, then it can result in side effects. But these side effects are less when compared, and these contrast media, these side effects are less than that of excretory urography. These are obviously less than excretory urography. Right. Then, due to contrast medium, if there is any stasis of contrast medium, if in the renal pelvic calyceal system, if there is stasis of contrast medium, then the patient can develop chemical pyelolysis can be developed in the patient. Then, because of the over distension of the pelvis also, the patient can develop extravasation also. Mm. Then there can be some side effects due to technique, because we are doing it is an invasive procedure. Definitely it is a big invasive procedure, because it is a little not bigger, but it is invasive procedure, because we have to introduce a cystoscope to the bladder, and through them we will have to introduce the we will have to catheterize the ureters. So as a result there is some problem of introduction of infection. Number one, there can be mucosal damage also, especially there can be mucosal damage to ureter, or there can be perforation of ureter also. Perforation of ureter or pelvis can also occur in this case. If you see, this picture is taken from StyleShare in this PPT. So right now this is the filming sequence. First this is the bladder here. Through the bladder first cystoscope is introduced, and through the cystoscope the ureteral catheter is introduced. Now a scout film is taken, followed by which 3 to 5 cc of contrast is injected by the urologist. Urologist will inject 3 to 5 cc of contrast, and after that you can see the renal pelvis which is seen. Followed by that, the urologist will now withdraw the catheter. He will withdraw the catheter 10 centimeters below the renal pelvis. In 10 centimeters below the renal pelvis, till here he will withdraw, and then again inject the contrast and take another film, that is one more film, and also again he will withdraw it just up to the ureteric orifice, like till here up to the ureteric orifice, just above the ureteric orifice he will again withdraw here, and then he will again inject the contrast and take another x-ray. So in that way we get almost 4 to 5 x-rays, and these can be compared with in retrograde pyelography. That means the main important thing which you have to remember here is that in order to approach the kidneys, okay, the main sorry, so in order to mainly approach the kidneys through the bladder, so these are the kidneys, right? In order to approach the kidneys, first and foremost we will introduce a cystoscope into the bladder. Okay, the cystoscope is introduced into the bladder itself, first cystoscope, and then through this cystoscope we have to introduce the ureteric catheter, which goes into the ureter up to the level of renal pelvis. Then after this we will take a scout image. Followed by that we will introduce the contrast medium. The contrast medium will reach the kidney and renal parenchyma pelvic calyceal system. Mainly the pelvic calyceal system, not the parenchyma, but pelvic calyceal system is filled with the contrast. Then you will have to withdraw this a little down till 10 centimeters below the ureter, and then you will again inject the contrast and then take one more x-ray, and then you will withdraw this catheter again up to the just above the ureteric orifice. When the catheter is here, again you will inject the contrast and take one more x-ray, and all these x-rays can be used for evaluation in retrograde pyeloureterography. Thank you.